When I received an email about the theme of this program this evening, it was healthcare reform. I didn't see the question mark. And then I saw the question mark, and it was healthcare reform? What's next? And I thought, Jesus, is there going to be another bank bailout that I don't know about? So, yeah. So, you know, my interpretation of healthcare reform, I think when I'm on the campaign trail, a lot of people come up to me and they say, this isn't what we expected. We expected health insurance companies to be kicked out of this system. That's what they expected. But what they got so far is this. We can expect the biggest taxpayer giveaway in the history of the United States. And they're paying it directly to the people who caused this calamity in the first place. That is wrong, and we have to change that. Don't make any mistake here on this. If you turn and give total or near total dominion of your health care system and policy over to the for-profit private insurance companies, they will own the doctors, they will own the nurses, they will own the hospitals, they will own you. You won't get the care that you need because in these policies and these proposals that are being presented, care is not guaranteed. You will be required to buy insurance. Care is only implied. They can deny you, just like they always have. And Jerry McDermott was exactly right on. This is an economic affair here. What's going to happen is this. They're going to get more of your public money, your taxpayer money, that you worked hard for, and that Larry worked hard for, and everybody else in this community here tonight worked hard for. It's going to go as a subsidy into their private for-profit coffers, and what they're going to do with it is buy more candidates so that they can solidify their power base in Congress. And they want to do it now and long into the future. So, when it comes to the question, what next? Here's my solution. Because I'm running for Congress, I'm well into the thick of things. I know what it takes to have a good crew prepared to run against a 5-term congressman. What we need to do, starting this year, and I want you to take down this date because Paul Wellstone Association, or whatever it's called, will have a training session April 30th until May 2nd. We have got to train more and more people to go out and organize for campaigns to get real progressive candidates elected to office for Congress. We have to do that. And then, when you get that training, I want you to go out into a real campaign and apply what you have just learned. Because 2 years from now, it's going to be very, very important to get more and more progressives elected, especially from this state, because I don't know about you, but for me, whenever I called my congressmen, my senators, and I told them, we need to get single payer on board, we need single payer on the table, and their actions were just the opposite. Do you like calling and calling and calling? How about if you called me and I would put single payer on the table? That's what I would do. Now, there are 2 reasons why we're having problems with our state budget and our federal budget. One, we don't have the jobs that produce the tax revenue so that we can pay for our colleges and our elementary schools. And we don't have the tax revenue to repair our bridges and to repair those ruts in the road. We don't have enough tax revenue to keep things operating as they should. I work in public transportation, and I apply for congressional appropriations. Some people call them earmarks as well. They are good things in some cases. But sometimes we just don't have the money available to replenish the buses that we have that are aging. So I apply for these appropriations. But the thing is, if we don't have enough jobs here to produce the tax revenue at this end, you have the health care inflation at this end, and it eats the operating budget from both ends. And then, when we have faint-hearted politicians who are afraid to stand up for people, it just goes even faster. We need to put progressives in office to stand up for you.